Yeah.
Cool. So perfect. I think here it's 8 a.m. Saturday. Sorry,
And
Friday
it's now
morning.
here.
It's Thanksgiving. So let me start to say that I am thankful for all my colleagues and friends around the world, dentists and others, because it's Thanksgiving here is a very, very important holiday. It's more important than Christmas, even.
Yeah.
Um, for North Americans, it's really a moment where, you give thanks for this place, for, it's historical from the pilgrims that were not pilgrims, but the settlers that were coming to America to take a time to thank God for everything that was given to them in this amazing land of North America.
Yeah.
So we love Thanksgiving and of
And
course plus it's
Thanksgiving, I want to thank you very much for giving me the honor today to make a small interview with you. And
perfect.
also, I'm thankful for the university and all my colleagues,
You're
family,
welcome.
and
My pleasure.
everything.
My pleasure to help.
Thank you. Thank you.
Always.
So I know, as usual, before we got tight in your time, I know you have tight time always. So let's begin today. I want to introduce you. Welcome here to Cairo University. Cairo University is the mother of all universities here and top one university in Egypt. And 323 globally. Also, we are trying to make it from the top 10 one day. And to all my colleagues, let me introduce you to them. Whoever don't know Dr. Pascal Magne, be careful, you are missing the train, but it's never too late. Dr. Pascal Magne is the Biomimetic founder and the author of Biomimetic books, and also known as the father of Biomimetic dentistry. He is an ex-professor in the University of South California. And guess what, guys? If you know what H index is, he is 69. This number is not real for H indexes. So search for it and you'll understand what 69 on H index means. So Dr. Pascal, let me introduce to you your audience today. They are all from, not all of them, they are from Egypt and Sudan, Saudi Arabia, California, California is, you are from California, and Nigeria.
I am from
sorry.
Originally Switzerland, but now California.
Yeah, hope one day we're gonna find a colleague here from California, no problem. And we have a friend from Nigeria and India as well. So just a light start, if we want you to give a great message to all the young generation and to all my colleagues who travel all the way searching for good knowledge here in Egypt. So what's your message to them?
So yes, if I may offer a word of wisdom to the colleagues and especially the young colleagues in Egypt, I would say, first of all, I tell that to all my students, you as a young person nowadays with social media, with so many distractions possible in your life, my first word to you is very, very easy. It's a 5-letter word called focus. Focus, F-O-C-U-S, focus. Really, don't let yourself be distracted. There is so much happening now in the world, in the profession. And I always tell my students, focus and find what I call your baby. What is your baby? Your baby is your passion. Is really what would keep us awake at night to study more, to learn more, to understand more. And we all have a baby that is something that we want to dig deeper, learn more, and ultimately become an expert about, right? And so this is what I recommend the young generation, is not to get distracted. You know, I took a seminar one day as a participant together with my wife, by the way. It was a couple retreat, a Christian couple retreat about, you know, having better relationships. And the essence of the meeting was saying that you should focus on your strength. Focus on your strength, because you will never be as good trying to improve your weaknesses than you will be focusing on your strength. That's my advice. There is, you know, God gave you gifts. There's a very important message in the Bible called the parable of the talents. The talents was a certain amount of money that a master gave his servant, and then the master left and told them, you know, use that money wisely. Some of them, one of them, he buried the money underground and did nothing with it. And when the master came back, he just dug the money out and gave it back to the master, the same amount he had received. The good servant made the money multiply. He made business, he traded, he made money. He doubled or tripled the amount. The master was very happy, I guess. You understand that, right? And so God is like this with us in terms of our talent. God is giving us gifts. So we all have certain gifts. I don't believe anybody who tells me I have no gifts. This is not true. We all have talents, gifts, and it is our responsibility to first, of course, discover those gifts, but then to make them multiply or fructify and increase. And that's what I call find your baby. Find the gift that God gave you and make that gift grow and become an expert in that gift. And, you know, it depends. For me, it's been almost since day one, you know, bonding of porcelain restoration, even though when I saw that, it was really not popular at all in the early 90s, you know, late 80s, early 90s, from the previous millennium. I learned bonding porcelain basically by myself, by just reading articles. That's it. And I had to really study, became my master thesis, became my PhD thesis, became the first book.
Yeah.
Basically, evolution. So that's, you know, like our, you know, we have
inspiring as usual, Dr. Pascal.
So, you know, we have a good friend called Mario, Eman, and Mario has always 2 points in his argument. So I will do 2 points. That was point number 1. Point number 2 is, you know, so point number 1, find your passion. Oh, yeah, I found it. Okay, so let's resume. So point number 2 is find a good mentor. Mentor is a dental father or mother, and is someone who is going to guide you to be really, like, you know, I always tell in my lecture, you can't choose your biological parents, right? But you can choose your mentor, your dental or dental father or mother. And to me, it's very important. I had 3 mentors in my life. I had, my first mentor was Dr. Belzer, my professor at the University of Geneva. I would say at the same time, my second mentor was my brother Michel, a dental ceramist, who taught me so much about aesthetic dentistry. And then my third mentor is Dr. Bill Douglas at the University of Minnesota, where I learned research in biomaterials and biomechanics. So, you know, you can have more than one father. That's what's beautiful. And of course, then there's the mentor of all mentors, which is God, who is God, the greatest mentor. But my earthly mentors are those 3, and they are my mentors still today. I still consult with them today as we speak, to ask them and it's amazing. It's the most beautiful thing to be adopted by a mentor.
Yeah.
So this was a very short answer to your question about my message.
Two things: mentor and passion, but in a very detailed one that I really enjoyed it, and I learned a lot from it as well. So you, as a Biomimetic founder, they gave me an introduction about Biomimetic, and I couldn't find a better one than this one. Why searching on Google when I know the founder? So, as an introduction, what is Biomimetic? What is the idea came from, and all of these?
Right. So, first of all, I want to have a little historical background. Biomimetics in itself, biomimetics, not biomimetic restorative dentistry, but biomimetics in general, is a science of medicine, right? That tries to copy or reproduce organs in the same way they are really found in the body, right? So some researchers, for instance, one of the most biomimetic thing I've seen in medicine is they created a scaffold of cartilage and covered it with skin. They grew skin, and they could redo or refabricate an ear, an artificial ear that was actually made of live tissues. You see, this is the real definition of biomimetics. So in dentistry, the real definition of biomimetics, which we actually performed, we actually made that happen, would be to replace missing enamel and dentin with real enamel and dentin. And that's the dream, and it is possible today. Did you know that?
Yeah.
You saw our article, I guess.
Yeah.
Right? You can actually use wisdom teeth or premolars that are extracted for orthodontic reasons, and in a very structured protocol that we published in the Journal of Prosthetic Dentistry, use these crowns made of natural enamel and dentin and place them strategically within a modified CAD/CAM block and have the fitting surface of those crowns adapted to the preparation, which can be an onlay or a partial crown, and then cement them as a prosthetic piece made of real enamel and sheen. You can do that tomorrow in your office, and that would be the most biomimetic restoration ever done. We have one that's been in the mouth of the patient for, I think, 6 or 7 years, and it works perfectly. And we have published 4 years follow-up, but more is coming. Anyway, the reality is not everybody has access to those teeth, which is a pity because, Mark, if you think about it, how many wisdom teeth and premolars go to the trash every day in the world, right? So really the paradox is that we are trashing natural teeth that we could reuse actually as restorations. On the other side, United States is paying millions and millions of dollars to researchers in a lab to fabricate enamel and dentin in a Petri dish. And you know what? They are barely able to fabricate 20 or 30 microns of enamel in 3 weeks. Can you imagine the time it takes to make a tooth, and then how much it will cost, right? And on the other side, we have extracted teeth, intact, beautiful, that we could use, and we are putting in the trash. That's another question. But back to your question. Biomimetic restorative dentistry, which is not exactly biomimetics, right? It's a principle. It's the principle to use synthetic materials to mimic enamel and dentin, right? And we have different levels of biomimetics. We have the level where we want to achieve an absolutely biomimetic result, which means we have to use different materials, one for enamel, one for dentin. Or there is an intermediate level where I would say we want to use only one material for both enamel and dentin. Because of social and economic reasons, we are led to do that too. Otherwise, biomimetic dentistry would be too expensive. So this is the beginning of biomimetic dentistry. So how do we replace enamel and dentin with the best materials? First, we have to study enamel and dentin, and that's point number one of what we call, biomimetic restorative dentistry. Study the natural tissues. Point number two would be to mimic not only mimic, but limit the loss of enamel and dentin during the restorative procedure. So that means, first of all, preventive, non-invasive and adhesive dentistry, but it means also trying to minimize the loss of tissue during access, for instance, to the decay. So if you access a large interproximal decay, sometimes you have to go through a big amount of intact enamel, maybe the marginal ridge of the tooth. So you have to think about the alternatives, and that's why sometimes we use a lateral access, which requires oscillating tips and specialty instruments to do that. So we'll talk about that later. But the ultimate goal, the dream, would be only to eliminate the diseased tissue without affecting the healthy tissue. That's the goal number two. Number three, it is about, and that one is a little bit shocking to a lot of people in the world. It's about getting away from the principles of retention and resistance form. That means we are no longer going to rely on geometry of the preparation, on accessory elements, pits and pins, and even, hear me well, we will completely abandon radicular posts, any type of posts, any type of retentive feature. The only thing we need is a positioning geometry that's, because bonding two flat surfaces against each other is difficult because you don't have a exact positioning lock. And so sometimes having a little bit of geometry just for accurate placement when the preparation is completely flat. Otherwise, but tell me, when is it that the preparation is completely flat? It's extremely rare. You always have a minimum amount of geometry, and therefore that's rarely a problem. So in this point, that means we are going to use a variety of options: direct, semi-direct, semi-indirect, and indirect. So those are my four restorative options in biomimetic dentistry: direct composite, semi-direct when you do a part of the restoration outside the mouth, and if you do it in one session, we call it semi-direct. If you do it in two sessions, we call it semi-indirect. And finally, the indirect one means with a dental lab. You send the restoration in the dental lab. So that's our terminology for those four types of restoration. And we are going to choose really the best technique according to the complexity of the case and also affordability by the patient, because I'm sure you have a lot of patients who cannot afford, a composite build-up with a thin ceramic veneers on top, and then you will have to choose a direct technique, maybe in that case, which is only one material, like I was explaining before. So that's point number three. Point number four, we need tools. To remove less tissue, we need to see more. See more to prep less. That means magnification. And as a joke, I like to say magnification. So you need to see more in order to prep less. That means other tools, micro instruments, oscillating instruments, then new techniques to save tooth structure. So we are using deep margin elevation. Then better delivery protocol where we use the thermo-modified luting technique. And finally, of course, optimization of dentin boning with the best adhesives possible, not the new kid on the block, the best proven adhesives with a long track record, and then immediate dentin sealing. This is just a little summary of point number 4. We are almost there. Don't worry, Mark. Point number 5, you know, this is really important, Mark. This is really important.
I really enjoyed what you are saying, so.
No, but I think I'm so glad you asked me this question, because, you know, there's a lot of people around who use the word biomimetics, but really don't really put together what I'm just explaining to you now.
That was question number 2, that some people use it as a trend, and
exactly.
We are
so
doing
that's why
we are doing biomimetics, so
right. I will tell you a little story about that after. Remind me, because it will allow me to define also what we call bioemulation. Okay, so remind me when I'm done. I have 2 more points and then I'm done. But bioemulation is an answer to that problem too, but I will explain. So point number 5, it's about survival of the tooth. What we do is about survival of the tooth. You know, when I was a student, I was taught classic prosthodontics, and classic prosthodontics, really the main issue with is that you are brainwashed about the restoration being the main focus. You are focused on the restoration. The restoration has to survive. The restoration has to be strong, the strongest. The restoration should be intact in the long term. And that is a wrong message. It is the tooth that should be intact in the long term. And what does it mean? It means that failure of the restoration can be actually good news, because it would mean that failure of the restoration prevented failure of the tooth. When the restorations are extremely strong and extremely stiff, stress distribution is going to go straight into the root, and especially we've seen that with posts and cemented posts, then the root will fail, and you will have patients come to the office with a tooth in their hand. It's the prosthetic tooth with a post inside, and they will come to you and they will say, "Oh, doctor, I'm sorry, my tooth was not strong enough for your crown." And they are almost sorry. In fact, it is the crown that was too strong for their tooth. And on the opposite, you will have patients with a chipped composite that will be upset with you. But the good news is you saved a lot of tooth structure by doing a direct composite, and the chipping can be repaired very easily. While on the other patient, the tooth has to be extracted. Maybe they will need bone graft and an implant, and it's a disaster. In the long term, we know there are lots of problems also associated with implants. By the way, just a little thing here. The implants, the way we do them today, are the most non-biomimetic restoration there is. Because you don't have a PDL, you don't have the flexibility of the dentin, and most prosthodontists restore rigid fixture with rigid abutments and rigid crowns made of ceramic and zirconia, and that is going totally away from what is the natural tooth. That's another section. But you understand now that in most failures in biomimetic dentistry, the choice should be to repair rather than replace. So these are the 2 elements of point number 5. It is number 1, 5.1. It is not about the survival of the restoration, it's about the survival of the tooth. And 5.2, it is about repairing rather than replacing. Failures in biomimetic dentistry are repairable. You don't need to replace the whole restoration. Okay. Now I go to point 6. Point 6 is really easy. You know, in biomimetic dentistry, we use science. Science is very important, but science is not always accurate. I'm a what did I just say? I'm a scientist. And I just tell you, yeah, why can I say that? Because I have an insider view of the publishing process of scientific articles. I've published, as you know, a number of articles, and I have some very interesting experience to tell you on how science can be biased, science can be censored, science can have mistakes. I've seen articles being retracted after they found mistakes, or after they simply found the data was 100% fake data, never experimented data. Can you believe that? You will have sometime, you will see in very high impact factor journal, an article being retracted because the data did not actually exist in reality. It was produced virtually, invented data. That can, scientists are not, they are just human beings, and they mess up too sometimes because they are human beings. They are not God. The only true science is coming from God, not from us. This is really, really important. So science is okay, but it's not enough. So number 2 is experience. So 6.1, science, 6.2, experience. Experience means if you tell me, I've been using this adhesive for 30 years, I don't have a problem, it's bonding well, I don't have sensitivity, what can I tell you? Nothing. Experience is a kind of science, of course. And finally, point 6.3 is common sense. God gives you common sense. It is here. It is in your brain and in your heart. And it really means choose the right thing, right? God gives you the ability to know what is good, what is not good. You have this inside you. And so common sense is very important. And finally, back to common sense. When science doesn't have the answer, because many things that we do is not backed up scientifically, when you don't have experience, then you have to rely on your common sense. That's the only thing you have left. And finally, point 6.4 is the patient. So science, experience, common sense, and the patient. The patient, why? You can have this amazing knowledge, experience, and common sense that tells you these patients need a $50,000 full mouth rehabilitation. And the patient looks at you and said, doctor, I have only $2,000. Okay. So you will have to find a solution for that patient, which might be big, large, direct composites with some, maybe a few indirect restoration here and there, but you will have to adapt to the patient's economic situation. Okay. And so point number 7, and that will be the conclusion of this definition. I know it was a little bit long. I'm sorry, but I think it's very important that we create the foundations. And point number 7 is think different. In biomimetic dentistry, we are allowed to think completely outside the box, and the adhesive principles allow us to do things we were never allowed to do before. And the examples are numerous, like I said, repair, with what's much more difficult to repair solid, solid gold, porcelain fused to metal, or zirconia is much more difficult to repair than, for instance, direct composites. So we have margin elevation was never in question. My prosthodontic education was you never place margins of an indirect restoration in anything else than healthy enamel and dentin. No, that's not true. You can do a composite elevation, then place the margin within that composite. So you see, we are allowed to think different and to think biomimetic. So that was a little bit my short answer to your question.
Perfect answer. Yeah. Just a small reminder, you ruined all my questions. You answered all of them throughout. This is good answer. But just to make sure that everyone understand the point that some people claim it's all about material. And some say it's all about working conservative, and some think, but I think it's like
the whole.
Yeah. It's like how they told us about the caries. It's a multifactorial. So it's not about one thing. It's about a lot of factors that can make you reach that study to mimic that nature.
Absolutely. And dental materials, I was telling you, you can do several levels of biomimetic, of emulation. By the way, just to tell you the quick story about bioemulation, my dear friend and student and mentee from Greece, Dr. Panayotis Bazos, known as Panos Bazos, he started the bioemulation group by trademarking that word. So the word biomimetics is, of course, free for use, and that's the reason many people are using it. But the word bioemulation, which is basically the same, emulation or mimicking is the same synonym. So bioemulation was born after trademarking that word by the bioemulation founders and Dr. Bazos, Dr. Politano, Dr. Tapia. And I was there at the foundation of this group, and I'm very proud of them. They do an amazing job. And what they do is they also a little bit protect those principles. And not anybody can use that word anymore because it is trademarked. I'm okay with both, you know, as long as we keep the definitions absolutely clear. But the bioemulation is doing a great job to spread the word of biomimetic restorative dentistry. Yes. So back to your, I was going to tell you about materials because you speak about materials. So listen, ideally, you want to use for dentin a specific material, which is more likely going to be a flexible material with a similar elastic modulus, which is composite resin. And nowadays, we have improved composite resin with fiber reinforcement. Especially our favorites are the short fiber reinforced composite resin, SFRC. And SFRC is discontinuous short fibers. We love them because we do a lot of research on them and they have very, very interesting properties. They can be used in bulk fill. They have a very high fracture toughness. They are as close as you can be with a composite to the dentin quality. However, and exactly like dentin, they should not be exposed to the oral environment because the fibers will degrade rapidly due to wear. They will give a rough surface, and it's not indicated to have that surface in the mouth. But you always cover them with regular composites. So then for ceramics, you could use, you know, of course, simple feldspathic porcelain is already stronger than enamel. So MARC, believe me, the weakest ceramic on the market today, which is called feldspathic porcelain, is stronger than enamel. Just to tell you that we really don't need Emax, lithium disilicates, lithium silicate, or even zirconia in biomimetic dentistry. We don't need that. But we can use them as a compensation for bad bonding. So because many people don't use optimal bonding strategies, the strength of the material will compensate for that. Because there is also an equation that I didn't tell you yet, but in biomimetic dentistry, the more you bond, the less you need strong materials, the less the design of your preparation is important, and the less you need retention and resistance form, right? And the more you can really use weak materials. So that's the equation in adhesive dentistry. So I think that you can do dentin for composite for dentin, ceramic for enamel, but not everybody can afford that. So if I ask you the question, what is a single material that has both properties of enamel and dentin, there's only one answer. It's composite resin. This is the closest. Composite resin, why? Because it has one of the key properties of dentin, which is elasticity, a low elastic modulus between 10 and 20 gigapascal. But at the same time, very good composites. I'm not talking about mediocre, flowable, injectable. I'm talking about condensable. They have wear properties, wear resistance, very close to enamel, not 100%, but very close. So imagine the main function of enamel is to resist wear and keep shape of the tooth intact. That's the function of enamel, is to keep the shape of the tooth intact. So wear resistance is one of the most important properties of enamel, also with the elastic modulus, which is to give rigidity to the crown. For the dentin, the most important properties is the compliance, is the resilience, the flexibility. So composite resin has both of those properties. So if you tell me what is the most biomimetic material as a single material, it's composite resin, but not any composite, just the highly filled, condensable, high elastic modulus composites.
More than a perfect answer. But I have another question. First of all, we have 2 minutes remaining. Okay, perfect.
Yeah.
So the next question is biomimetic dentistry is only related to restorative dentistry, or other specialties could be included?
So, no, I think that there is a lot we can extend to other fields. But first of all, I want to talk about, for instance, endodontics. It's still restorative somehow, but endodontics is has a potential for biomimetic improvements, in the sense that we know that there are different ways of opening a tooth for endo. And what we've done is we've partnered with very good endodontists whose goal is to minimize the loss of tooth structure during endodontic access. So I like to call this microendodontics, which means, really tiny little accesses, which makes cleaning more challenging. But, who said it would be easier to do biomimetic dentistry? In the long term, it is better and easier, but in the short term, when you have to do it, it takes more time. So a biomimetic endodontics means, for instance, we have a very interesting colleague, by the way, he is Egyptian. Can you believe that? And so you have one of the most biomimetic colleague in the world in endo, and his name is David Ihab Kellini. David Kellini. He's a professor also at USC, and he's going to teach courses for our biomimetic classes. And what he does, he uses the exact same technology that you use for implant placement, which means surgical guides, using a software, by the way, which is a free software called Blue Sky Bio, to design endodontic guides where the burr is guided exactly to the location of the pulp, and allows him to make a single root treatment through an access of about 2 millimeter wide. And that
I only have a small idea that always comes to my mind when it comes to endodontic biomimetic. I don't know if it's a right idea or not, but I think what we lost from losing the pulp is dentinal fluids. So I don't know why they didn't make a materials that can inject fluids in the dentinal to use again, so it can resist any fracture stress.
Yes. So I will tell you something, Mark, you will be a little bit surprised, but the loss of the pulp is not really a problem from fluid perspective, because think about the tooth. The tooth is sitting 24 hours a day in the oral environment, and the oral environment is wet. The PDL, the periodontal ligament, is wet. Everything around the tooth is full of moisture. So the tooth, and it's actually proven that the tooth does not exactly dehydrate or lose fluids. It is a sponge. The tooth is a permeable membrane. It sits, imagine a sponge in water, it will always be wet. And that's what the tooth is. So the tooth is wet enough. Now, the problem with losing the pulp is you lose the receptors, you lose the feedback, the electronic or electric wiring to the brain. That's what the main problem is. And we know from different research that when you place force, you see, listen, this is very interesting discussion, Mark. When you load a vital tooth, the receptors in the pulp and the PDL will tell you to stop at one moment because it hurts. If you load a non-vital tooth, even though you still have receptors in the PDL, but somehow the fact that you don't have receptors in the pulp will allow you to go at a much higher load before it hurts. So basically, my question to you is now, are non-vital teeth breaking because they are weaker or because the brain gives less feedback about what is the maximum load that will induce a problem? You see, so it's a very complex problem, very interesting discussion. That's why the only biomimetic way which is starting to emerge is to substitute the pulp with vital tissue. And that's what researchers are really trying to do now. It's pulp regeneration, right? And to fill the canal with something that's live tissue rather than basically doing like Egyptians, mummifying the tooth, right? So it's interesting. Egypt is all over the discussion today. I'm so glad because, you know, I have a huge fascination for Egyptian culture. And of course, Egypt is so many times in the Bible that I read so often. So I learn a lot about Egypt. Anyway, so you see, you don't, ideally, the future is really regenerating the pulp. So that would be the most biomimetic restorative treatment also done in endo. Then if you think about perio, for instance, periodontics, periodontists, interestingly, you will like that story, are sometimes begging me. They are begging me to do margin elevation. Can you believe that? A periodontist asking me why? Because periodontists know that when you need to take care of a deep margin, you have to remove bone. You have to sometimes expose the root, expose concavities between the roots, expose a furcation, and that's worse than anything else. And instead, the periodontists, they said, you know what, I can't do crown lengthening here. I can't. So please do a margin elevation. Otherwise, we have to extract that tooth. And that would be the biggest mistake. So many teeth are saved from extraction because of margin elevation. So periodontists are also becoming more biomimetic by not only accepting margin elevation, but begging us to do it. You understand? And then, and you know, of course, in implant dentistry, there is so much to do. I always say, if I need an implant in my back teeth one day, at the moment, all my teeth are vital. I make a confession here. All my teeth are vital. So thanks God, please stay like that. But if I needed an implant one day, I would love that implant, and you can quote me, to be restored with a composite resin crowns in order to compensate for the rigidity of the fixture. Because we made actually some very interesting studies, and I can send you those papers published in the Clinical Oral Implant Research Journal, where we show that when you use composite resins components for abutments and crowns on implants, you can restore the flexibility and what we call the damping behavior, the response to impact loading. You can reproduce the damping behavior of the natural tooth. But when you use zirconia, ceramic, lithium disilicate, and lithium silicate, the restored implants never responds like a tooth. It's much more rigid. And then we have a lot of problems that, you know, chipping of the ceramics, occlusal adjustment is very complicated. And then, of course, who knows the deformation and micro gaps at the abutment implant interface, because now many implants are bone level. So imagine when you have a rigid restoration, we have also a study that proved that you have more opening of the micro gap at the bone crest level because of the rigidity of the restoration. And when you have a composite crown, there is less deformation and less micro gap, reopening. Can you believe that? So this is biomimetics applied to other field, even though it's still restorative. And yeah, then you have occlusion. You know, what is the biomimetic occlusion? I'm often asked. And to be honest with you, it's a long, we can open a discussion about occlusion for another 2 hours, but I love the concept that was proposed by Dawson. I'm a big fan of Dawson occlusion because is the freedom in centric, is the, you know, it's a horizontal freedom to go. Patients are not locked. We know today that, you know, gnatology and tripodism is impossible. Only robots can do that. And so we have freedom in centric, we have freedom around MIP that allows us to go to what is called centric relation. I wouldn't call it like that anymore, but because the definition is changing every 10 years. But we have a certain, you know, the system is not rigid. We are not an articulator. So we have freedom around centric. I love, you know, to me, the most logical occlusion is called mutually protected occlusion. And it has a biomimetic source. What is it? Look at the canines. Mark, why did God make our canine with the longest and strongest root ever? How many times have you seen a root of a canine break, right? It's rarely happened, right? So a canine is designed for guidance. The shape of the crown, biconvex, the root strength, it's designed for guidance and separating of the posterior teeth during excursion and protection and avoidance of especially non-working interference that have to be avoided at all costs, because non-working interferences are the most nefast, the most harmful interferences. You know that you go there during night, bruxism, you are trying to eliminate those non-working interferences. And those non-working interferences, they can break a natural intact tooth also. Not, you know, some people come to me and say, oh, I'm so sorry, my onlay split tooth. Yeah, but it can break a natural tooth. So the non-working interference is really your enemy. So mutually protected occlusion, anterior teeth separate the posterior teeth during excursions, and then posterior teeth protect the anterior teeth during mastication. And that's why you have most of the interdigitation, grinding of the food in the back without the anterior teeth touching. Biomimetic occlusion.
This is more the I'm speechless.
Well, I'm
nothing to say.
I hope that I'm guessing all the students will listen to that. So I hope it inspires them, because there's so much, you know, and we have not invented anything. We have not created anything. Is God who created everything. He is the one that designed things. We just have to copy what he did and study what he did. And, you know, this is the first thing I did in my PhD studies. I went to Minnesota. I wanted to restore teeth and break them and see the strength. And my mentor, Dr. Bill Douglas, told me, wait, Pascal, stop. First, take intact teeth and study them and bend them, study the bending, the stress, do finite element simulation. So that's what we did. And actually, he's the one who told me in 1996, he said, Pascal, what you are doing is called biomimetics. You are trying to mimic nature. So that's how I used the word in 1996 and further. And it's true, we have to just pause and look at the beautiful, amazing natural dentition that God gave us. That's the first step. And copy. Drawing, I have behind me a few drawing you see down there. That's what we teach. So professors and at the University of Cairo develop this skill of your student. Observation and copying. Drawing is not only for the skill, the art of drawing. No, it's to develop your ability to copy. It's very, you see the drawing here is the Afghan girl from National Geographic. I did that as a copy exercise to learn the skill of copying, because Mark, we are not creating anything new. We are copying, emulating.
Just
right?
copying.
Exactly. So 2D is drawing. Copying in 2D is very important, because you need, there is a book by Betty Edwards, a professor. She's a professor who teaches drawing at UCLA, and maybe now she's retired, but she says that you need 5 perceptual skills in drawing. And I discovered that those exact same skills is what you need to do a good aesthetic restoration. Frame. So first you start with a rectangle. Each tooth fits in a rectangle. Each smile fits in a rectangle. The face fits in a rectangle. So that's called frame. Then there is what is called outline. Outline is the contour of the tooth. The contour of the tooth and the space between the frame and the contour, which is called the negative space. So that's outline. Then you have elements. Elements means, okay, inside the perimeter of the tooth, you have what? You have eyes, nose, mouth. So you have line angles, lobes, convexities, concavities. And then that brings me to number 4, which is highlights and shadows. So you have area that reflect the light, area that absorb the light, highlights and shadows. And number 5 is you zoom out and you look at your drawing from far and you see, does it look like an Afghan woman or not? Yes or no? You look at your drawing of a tooth. Does it look like a tooth or not? Yes, it does look like a tooth. That's called Gestalt. Gestalt is a German word from art, and design and architecture. It means it looks good as a whole. The sum of each element is bigger than, the whole is bigger than the sum of each element. So there is synergy. In Gestalt means there is synergy. When you have an eye by itself, it's different than we have 2 eyes together. Now an eye, a nose, and a mouth, and hair, and all the sum of these elements, it's one thing. But when you look at it as a whole, it's a much bigger thing. It's the Afghan woman, And so this is all also from art, of course. But I wanted to say that because it's very important. Drawing develops the essential perceptual skills that you need to do a good restoration. Then you go to 3D, which is wax up. Wax up is very important. Mark, I'm worried about the new generation, especially here in America, where everybody has a scanner, a CAD/CAM machine, automatic smile design. Machines make the work of the human, and that's not good. So I think we lose the skill of wax up, of making a tooth by hand. So this is 3D wax up. And then there's the ultimate stage, which is 4D. 4D means layering, and created the area of opacity, translucency, coloring, etc. That's the 4th dimension.
Dr. Pascal, I'm very, very, very thankful. I'm very thankful.
No, really. Thank you.
It was, I really, it was very insightful, and I am sure that all my colleagues enjoyed it and get a very huge outcome from this interview. And I'm really proud and happy for that interview, and I'm really thankful for you for doing that. It was amazing. Thank you.
Thank you. I want to really say all my best wishes to all your colleagues at the University in Cairo. God bless you and all the students, of course. I can tell you, students who are going to watch this, I hope you will be blessed. And that you develop those skills that we are talking about, that you find a mentor, that you focus on your baby. And I'm looking forward to see all the beautiful dentists that are going to come out from this precious teaching that you are going to give them. God bless you and bless Egypt. We love you.
Thank you.
Okay. Thank you. Okay.
Have a good day.
Thank you, Mark. Have a good day.
Thank you.
And let's stay in touch. Okay. Bye-bye.
Bye-bye.
Ciao. Ciao.